This is exactly what going to the dentist wasn't like for me growing up. It was a nightmare. The smells and the lighting and the sharp tools. I didn't understand as a 6-year-old the concept of stress, but I felt it. I wanted out of there. As a reward for my suffering through this experience, my dentist at the end of my visit would open up a cardboard chest, and he would allow me to pick out a toy as a reward, something like this. For me, this was gold. It didn't take a lot of effort from the dentist, but it was a small gesture with big impact. It made me feel loved and cared for in a moment when I was stressed out. Now, imagine you're a 6-year-old and you walk into a room and there's sharp lighting and scary tools, and this isn't your dentist office. You're in the hospital and you're looking around and you see your doctor talking, whispering. You see your mother crying. And you realize that you hear the word cancer and that you're going to be here for over a month. At that moment, does something like this take the stress out? When the stakes are so much higher, what does it mean? What will it take to lower a child's anxiety? Ohio State's Wexner Medical Center had that exact question. They needed to take patients who were migrating from Nationwide, a children's hospital created especially for them, and bring them over to Wexner, a remarkable facility, but it was for patients of all ages. And they needed to take the edge off and make sure that their patients and their families knew that they were in good hands, that they were taken care of. Just good bedside manner. Technology has the ability to function like bedside manner. It has the capacity to amplify humanity's best virtues. For Wexner's Medical Center, we worked with their wonderful staff to create a magical forest in their waiting room. And it did crazy things. Trees grew faster than beanstalks, and eggs hatched things that don't come out of eggs. And there were mushrooms that turned into UFOs and flew off. And there were animals, lots of animals. Because this isn't just any kind of forest. Every patient who walks into Wexner's Medical Center in their waiting room receives a medical bracelet. And that medical bracelet allows you to adopt one of those animals. And he becomes your pet, and he follows you along on your journey. When you're in the waiting room, you can play hide and seek. But when you move to the doctor's office, he's there, waiting for you, waving. When you move to anesthesia, the animal falls asleep when you fall asleep, wakes up when you wake up. Even more so, in the doctor's offices and rooms, you're able to change the lighting to your favorite color. We're giving agency to children at a time when they have zero control over their own lives. Now, we wanted to create an experience that wasn't going to be a burden to you. Technology became a real nightmare, and you have enough headaches with EMRs as it is. So what we did was create a foolproof system. You don't need to train your receptionist. There's no onboarding. There's no firewalled medical records. There's no COPA laws. We don't even need to know your name or your gender. It's just a bracelet. It's a simple effort. It's a big impact. It's your dentist toy, but it's 2.0. Now, we often think of healing from the perspective of what it means from a doctor or a nurse. That bedside manner comes from people. But when you imbue a hospital or facility with bedside manner, you double down on your commitment to wellness. You say that you are in good hands. You are cared for. And that compassion, that's not just for children. That's for you and me. That's for everyone. Now, we set out to make sure that the children were less stressed. But what we're surprised by is that there are much more significant benefits as well. The cortisol levels of the patients drop. There's less anesthesia, which means that it's safer and it's a faster healing time. It balances out your cytokine levels. And all of that means that your job is easier, you increase patient capacity, and you can do your job because you can focus less on de-stressing a child and more on your patient care. Now, this is a thing. It's called positive distraction. There are white papers about it, and it works. But if you read them, TV is a positive distraction. Video games, this toy is a positive distraction, and they all work. Anything that relieves a stress of a child by diverting attention is considered successful. But this is not positive distraction. This is digital compassion. Because when I walk into a room and my animal is waving at me, I feel known. And when I walk into a room that's my favorite color, I feel loved and recognized. And when I wake up next to an animal the same time I wake up from surgery, I know I'm being cared for. That's not distraction. We've created an experience where people can mine and build their own reservoir of love and compassion to get through the stress on their own. And I think that this is just scratching the surface. Wexner is dipping into what is possible when you mix compassion and technology and design. And that's really exciting. And what I want to know is, imagine what we can do next.